I'm Dr. Deuk Laser, and I'm here to talk to you today about Tiger Woods and his story and his battle with chronic lower back pain. Chronic lower back pain is one of the main common reasons people go to the doctor worldwide. There are 1 billion people worldwide suffering with chronic debilitating lower back pain. Tiger Woods is just one of those victims, and this is a story about how back pain ruined Tiger Woods' career and literally took away billions of dollars worth of value from his professional career as a top golfer and celebrity in the world. Now, Tiger Woods' problems with lower back pain started well before his first surgery in 2014. Tiger Woods had a microdiscectomy performed. Now, microdiscectomy is a procedure that's been around for years. We've stopped performing them at Deuk Spine because they are too invasive and they do destruction to the spine. It wasn't long afterwards, because he kept complaining about back pain, that he ended up having a second microdiscectomy shortly thereafter. So he had 2 microdiscectomies. Now, this is an invasive procedure where muscle is being cut and destroyed, and that's why people need painkillers after the surgery, like narcotic painkillers. Tiger Woods had his experience with narcotic painkillers. He ended up getting addicted to them, and he ended up having problems, including a DUI, that were related to the use of opioid narcotic painkillers after his back surgeries. So you might ask yourself, well then why did Tiger Woods, this famous golfer who's got clearly enough money to afford to go to the best surgeon in the world, why did he end up with a microdiscectomy? And the answer is, all too many doctors out there, even famous doctors like the ones that Tiger Woods went to, they don't know about the advances there are in spine surgery because they sort of learned how to do the surgeries like microdiscectomy back in their residency training years, and they've just stuck with those procedures. And they also knew that if this didn't work, the microdiscectomy didn't fix Tiger Woods' problems, he could always come back and get pain management, shots, pills, radiofrequency ablations, and eventually he would end up getting a fusion, which is exactly what happened to Tiger Woods. He had his fusion in April of 2017. He had what's called an anterior lumbar interbody fusion. So if you look at the spine, the lower back has a series of bones and discs between the bones. An anterior lumbar interbody fusion is where the surgeon goes through the belly, moves all the intestines over, and basically cuts the disc out through the front, puts a cage in there, and then a plate. So ALIF is not a surgery that's recommended much anymore. There's a few surgeons who still do it, and maybe Tiger Woods chose a surgeon who did ALIF because that was sort of an older, more experienced surgeon. The problem with going with older and more experienced is often that they don't keep up to date with the newer technologies. Medicine is driven by technology, and the newer technologies often afford patients better options for care. Unfortunately, Tiger continued to be plagued with back pain. He ended up having another microdiscectomy performed next to the fusion because fusions cause a syndrome called adjacent segment disease, and that's where you fuse one disc in the spine. For example, the L5-S1 joint is fused, and that puts additional pressure on the L4-5 joint. That causes the joints above or even below the fusion to become painful and wear out very quickly. That's what happened in Tiger Woods' case, and again in December of 2020, he had a 3rd microdiscectomy surgery. So after that procedure, shortly, a few years later actually, he ended up getting a disc replacement. So in October of 2025, just last week, Tiger Woods had his 6th back surgery, and he continues to suffer with back pain. So let's take a moment to think about the toll that chronic back pain has taken on someone like Tiger Woods' life. And I'm going to tell you this is a very common scenario that we hear about over and over again in patients with chronic back pain. They start to treat their pain with conservative treatment like pain meds. They end up getting addicted to the pain meds. They end up needing more pain meds because the pain meds they were taking lose their effect over time. This is a phenomenon called tolerance. It's well known and established when it comes to pain medication. We become tolerant to pain medicine just the same way we become tolerant to alcohol. If you drink alcohol every day, you find that it doesn't have the same effect. You need to increase the amount that you're drinking. You go from 1 ounce to 2 to 3 ounces to get the same effect. So people develop tolerance to pain medication, and Tiger Woods did. As a matter of fact, when he was involved in his DUI in 2017, He was on hydrocodone, hydromorphone, which are both narcotic painkillers. You should only be on one at a time. He was on two because the pain was so bad. He was also on alprazolam. Most of you know it as Xanax. It's basically to calm your anxiety. So it turns out people with back pain have anxiety problems. They have depression. They have all kinds of mental health issues because they're suffering with back pain. They're not sleeping well. Their life is destroyed. His career was destroyed. He could not do golf. He couldn't be successful. He couldn't perform like he was supposed to. And you have all this pressure on you to perform from your sponsors, from your friends, from your family, from your spouse. So Tiger was under tremendous emotional, personal pressure, anxiety, depression, and the medications he was taking, this alprazolam, for example, it tends to cause depression. So do the narcotics. They cause depression as well. So he was on an antidepressant at the same time, zolpidem, and he was also on THC. So basically, we call this polypharmacy, where patients with a chronic medical condition are trying to find some way to alleviate the symptoms and how the effect of the symptoms are on their life. So they end up trying all kinds of different drugs. And the next thing you know, they end up either dead because they've overdosed or they end up in an accident like he did. So I really feel that it's important that you all know that there are better treatments available, but you will not hear about these treatments from most spine surgeons or pain management doctors because A, they don't know about them, or B, they're not making money off the treatment. So they're going to recommend the treatments that they're going to make the most money off of, which are the ones that they can provide you, not the best treatments for you. Every patient at Deuk Spine Institute comes in and has one back surgery for their problem. If you have a bad disc causing pain, we go in and do laser, and that's the last time you're going to need surgery on that disc. Now, some people end up with other problems causing back pain, like piriformis syndrome, where they have a tear in the piriformis muscle that causes horrible back pain. And the way we fix that is with the Deuk piriformis release. That is very successful at eliminating back pain from a piriformis muscle tear. There's also sacroiliac joint pain, or sacroiliitis, as most of you might know it, where we can go in and basically destroy the pain nerves to the joint, permanently eliminating back pain. Finally, there are facet joints. Facet joints are not well known by most people, but they're a small joint in the back of the spine. And there is no effective treatment at eliminating facet pain permanently except for the Deuk plasma rhizotomy, another patented treatment available at Deuk Spine Institute. To learn more about the Deuk Laser Disc Repair, please visit Deuk Spine Institute's website or our YouTube channel and hear from the hundreds and hundreds and hundreds of patients we have cured over the years and eliminated their back or neck pain. You can also follow us on our podcast. Have a great day. Thanks.